A case study of a patient with acute bronchitis, presented by Mini Chakiath Varghese at the Brandman University. Chief complaint and subjective data. Chief complaints are productive cough and low-grade fever for 2 days, shortness of breath while coughing for 1 day, and fatigue for 3 days. A 34-year-old Asian female came to the clinic with the complaints of productive cough and low-grade fever since 2 days and shortness of breath while coughing since 1 day. She said that she's very tired and cannot go to work due to cough. She's worried about missing more days at work. She has body pain and chills at times. Patient is taking Tylenol for pain and over-the-counter Mucinex expectorant tablets for her cough. Past medical and surgical history. Childhood, none. Surgical, none. Psychiatric, none. OBGYN, she is G2P2. All kids are doing fine. Family history. Patient's father has type 2 diabetes mellitus. Her mother has hypertension. She has no siblings. Patient works as a banker and she lives with her husband and 2 children. Other significant data. Patient is taking Tylenol and over-the-counter Mucinex tablets. She has no drug allergies. She does not smoke and she takes a glass of wine once a week, and she doesn't take any illicit drugs. She works as a banker and she normally walks for 1 to 2 miles a day. Her immunizations are all up to date. Objective data. Vital signs. Patient's blood pressure is 120/75 millimeters of mercury. Her heart rate is 79 per minute. Her temperature is 99.7 Fahrenheit. Oxygen saturation is 98% and her weight is 145 pounds. Patient looks well nourished and well groomed, and she makes fairly good eye contact, but she looks anxious and tired. Patient has no skin lesions, bumps, acne or pimples. There is no discoloration on the skin. She has no vision changes, pain, redness, excessive tearing, and double vision. Patient has no blurred vision. She has no hearing changes, tinnitus, and she has no earache. She has no discharge from the ear. Patient has no maxillary sinus tenderness, no itching, hay fever, or nose bleeding. She has no bleeding gums, crack on the tip of the tongue. She has dry mouth and she also has mild throat ache from coughing. And she has no lumps, no swollen glands, goiter or neck stiffness. Physical examination. Her head atraumatic, normocephalic. Patient has no lesions. Eyes. Sclera white in color, pupils equal and reacting to light. EOMI, patient does not use glasses. Ear. She has no discharge, pain or redness in the ear. Nose and throat. There is no discharge, redness or swelling. Tonsils are not enlarged. Throat has mild redness from persistent cough. Patient has mild pain while swallowing. Face. Symmetrical. Neck. No thyroid enlargement or no lymph node enlargement. Respiratory. CTA bilaterally, no wheezings or crackles. Cardiovascular. S1, S2 heard, regular rate and rhythm, no murmurs, gallops or lifts. Differential diagnosis. The primary differential diagnosis is acute bronchitis based on all the signs and symptoms. Other differential diagnosis could be allergic rhinitis and upper respiratory tract infection or common cold. Recommended diagnostic testing for acute bronchitis: sputum culture and sensitivity, chest x-ray, blood tests for CRP and CBC, and pulmonary function test. Recommended treatment plan: rest, plenty of fluid, and Tylenol to treat fever. Antibiotics usually aren't prescribed for acute bronchitis since they don't work against virus. But the provider may prescribe antibiotics if he or she thinks it is due to bacteria. A humidifier or steam can help loosen mucus and relieve wheezing and limited airflow. An inhaler to open up the airway, medicines to relieve or reduce cough and treat inflamed airways in case of persistent cough. Clinical practice guidelines as per the CDC. Condition: acute bronchitis. Epidemiology: cough is the most common symptom for which adult patients visit their primary care provider, and acute bronchitis is the most common diagnosis in these patients. Diagnosis: pneumonia, which is a rare among otherwise healthy adults in the absence of abnormal vital signs, which are heart rate of equal or more than 100 beats per minute, respiratory rate of equal or more than 24 breaths per minute, or oral temperature of equal or more than 38 degrees Celsius, and abnormal lung examination findings such as focal consolidation, egophony, or fremitus. Colored sputum does not indicate bacterial infection. For most cases, chest radiography is not recommended. Management: with antibiotics is not recommended regardless of cough duration. Options for symptomatic therapy include cough suppressants such as codeine or dextromethorphan, first generation antihistamines such as diphenhydramine, decongestants such as phenylephrine, and beta agonists such as albuterol. Treatment based on evidence. Based on the evidences, the patient who came to the primary care office was treated as follows. Patient was advised to continue Tylenol for pain and discomfort, continue with the over-the-counter Mucinex tablets, albuterol puffs 2 mg 3 times a day, rest and sleep, plenty of fluid, avoid crowded areas, pollens, dust, and air pollution. Return to the clinic in 2 weeks if the symptoms worsen, or to go to the ER if patient has chest pain or increased shortness of breath. Follow up and patient and family education. Acute bronchitis often occurs with a viral infection, such as the common cold, and is sometimes called a chest cold. The common symptoms of acute bronchitis is a nagging cough, which usually subsides within 2 to 3 weeks. Rest, fluid, and staying away from dust, crowd, and pollens will help. Hand washing is an essential and highly effective way to prevent the spread of infection. Wet your hands with water and plain soap and rub them together for 15 to 30 seconds. Pay special attention to the fingernails between the fingers and the wrist. Rinse your hands thoroughly and dry with a single-use towel. Wash your hands before preparing food and eating. After going to the bathroom and after coughing, blowing the nose or sneezing. While it is not always possible to limit contact with people who are ill, avoid touching your eyes, nose, or mouth after direct contact when possible. Use a tissue to cover your mouth when sneezing or coughing. Throw away used tissues promptly and then wash your hands. Sneezing or coughing into the sleeve of your clothing is another way to prevent spread of infection. Thank you for listening to my presentation. Have a great day. Bye.